stressed without reason, nervous without cause, palm sweating, heart racing. But why? For many, these symptoms are related to the emotion of feeling anxious, typically related to something you are nervous for or feeling uneasy about. For individuals with general anxiety disorder, these feelings are common, though similar to exhaustion or hunger. Though, as many may not realize, these uncontrollable feelings have the power to affect not only the way one thinks and processes information, but how they live out their daily lives. Generalized anxiety disorder is a severe and chronic anxiety disorder characterized by uncontrollable worrying and somatic anxiety. Said symptoms are to be occurring more days than not for at least 6 months, about a number of events and activities. The individual may find it difficult to control the worry, but often feeling restless or on edge, irritable, muscle tension, and or sleep disturbance as determined by the DSM-5 diagnosis criteria. The criteria must also meet the requirements of having at least 4 symptoms from these categories being present. The automatic arousal symptoms include palpitations, which is pounding heart, or accelerated heart rate, sweating, trembling or shaking, and dry mouth not caused by dehydration or medication. Symptoms involving chest and abdomen are difficulty breathing, feeling of choking, chest pain or discomfort, nausea, and abdominal distress. Symptoms that involve the mental state may include feeling dizzy, unsteady, feeling a loss of control, passing out, or fear of dying. Lastly, other general symptoms necessary for diagnosis include hot flashes or cold chills, numbness, tingling sensations, feeling mentally tense, and the inability to relax. Though symptoms are prevalent, the criteria increases and decreases depending on the threshold of the diagnosis. Generally, anxiety disorder is one of the most common mental disorders affecting nearly 7 million adults in the United States, and is twice as common in women than men. Generalized anxiety disorder is commonly found alongside other illnesses such as mood disorders, major depressive disorders, panic disorders, obsessive compulsive disorder, other anxiety disorders, as well as post-traumatic stress disorder. Though an individual is diagnosed based off the criteria met by the DSM-5, a comprehensive history is made, such as psychiatric history of yourself, as well as relatives, and tests such as blood cell count, comprehensive metabolic panel, thyroid hormone, and urine toxicology. According to the Anxiety and Depression Association of America, although the exact cause of generalized anxiety disorder is unknown, there is evidence that biological factors, family backgrounds, as well as life experiences play a significant role in developing the disorder. Though it sounds intense, and it definitely is, let's take a look at how individuals with anxiety disorder go about their daily lives. According to the Anxiety and Depressive Association of America, whether an individual's anxiety level is mild or moderate, with or without treatment, people living with this disorder can function socially, be content, fully employed, and live fulfilling lives. Although many of these individuals may avoid situations that may trigger or cause symptoms to occur, or they may not take advantage of opportunities due to their mental situations that may bring on worrying or overthinking. When someone has severe anxiety, it can be difficult for them to carry out even the simplest of tasks, such as going to school or going to work, or even getting ready in the mornings. For most individuals living with anxiety, they tend to get to know their disorder over time, as it is a major part of who they are, and has significant control over their lives. When they're able to be aware of things that trigger excessive symptoms, it makes it easier to cope with daily situations. But it does not mean they are not as a constant battle with themselves over something they have little to no control over. Now on to the big question. How do they get treatment? Because every case of general anxiety disorder is different, as previously mentioned, there is not a simple solution for everybody, and it takes a lot of time and various methods for some. Now let me clarify. When I speak of treatment, I don't mean that once a patient receives treatment for their disorder, it goes away. I mean, when the individual is undergoing treatment, their symptoms lessen, typically about 50%, and they gain a bit more control over their illness. But generalized anxiety disorder never goes away when present. Treatment methods include talk therapy, where an individual can find support, cognitive behavioral therapy, which specifically targets thoughts, physical symptoms, and behaviors, and mindfulness therapy are found the most effective. All forms of therapy guide people on how to relate to their symptoms and help them understand themselves and their disorders, and how to make decisions in the presence of anxiety. Various relaxation techniques such as yoga, meditation, and exercise have also been found helpful, as it provides their loud minds an opportunity to be calm. There are also medication options available as well. Antidepressants such as imipramine, proxamine, venlafaxine, Zoloft, Lexapro, and so forth are commonly prescribed for alleviating the symptoms experienced. Antidepressants are serotonin reuptake inhibitors, which act on the brain's chemical serotonin and norepinephrine, controlling the chemical imbalance found in generalized anxiety disorder, according to the professionals at WebMD. As you can see, anxiety is commonly belittled by people who may feel nervous and are unaware of the severity it obtains. Generalized anxiety disorder is very common and should be taken very seriously, as it contains sensitive symptoms that are not easily overcome. As you can see, this is a picture of a brain with generalized anxiety disorder present, whereas this is a normal brain. You can see that there is a lot more activity in the frontal lobes happening with people who have the disorder present. So it's definitely not something to overlook.